The thing with your case is like there's two thoughts. One is like, does a person, like when I evaluate your case and evaluate case history of someone, is there a misdiagnosis, or is there a diagnosis that's not named, but a person has dysfunction, and is there a cure or treatment for it? There's all the different things to think about, right? So my first impression with your diagnosis is that, well, for sure your gut nervous system is not working, right? And I just want to get more details of like, is that a developmental issue from the very beginning, or it's not very clear from your case study exactly when those problems started. And then there's the second part of it, which is, can you even do anything about it, or how do you improve function with what you have? My first impression with your case is like your enteric nervous system has probably been off since you were born, right? And it's been issues, and you have to learn how to function with what you have at the highest level you can. That's my first impression. I could be wrong.
I haven't had gut-related issues till maybe sometime in high school.
Okay, so that changes things.
Yeah.
So let's talk about that. So when you were first born, you didn't have any issues with constipation or problems?
As far as I remember, no.
So up until before high school, you had no issues with bowel movements, and you had regular bowel movements. Let's timeline your motility first. So when we look at your gut nervous,
even more than that, like even after university. So I would say, so I finished university in 2001. Maybe around 2004. That's when I actually started noticing that, getting bloated.
How old were you then?
2004. How old?
24,
27, 28.
So the first 26 years you had no problems?
No, 27, 28 we married.
We married, okay.
So it should be five years back.
I'm saying, let me think about it. So 2001, I finished university. I haven't had any issues.
I think 22. Like 4 years after.
Okay, let's just say 20.
22, okay.
Yeah.
22, okay. So the first 21 years you had no constipation issues, no motility issues, no bowel problems?
No,
None?
Nothing.
Okay.
Nothing. It's like I was always a bit grumpy and agitated and what else? And a little bit of, now, like if you want to put a name on it, a little bit of bipolar, because I had mood swings. There was no diagnostic ever. But I had these issues, like I remember in in high school, so let's say when I was 17 years old, I was, like, sometimes I was unhappy. Or even in middle school.
Okay.
When I was like 14, 15 years old, I was unhappy.
Well, we'll get to that first. Let me just figure out.
But no gut issues.
Let's what I like to do is go over the gut motility first, then go into your brain, and then your relationship between your gut and brain now, and go from there. Okay.
Yeah.
But your gut motility is important. So, because it's either like your gut nervous system may have not developed, because you could have had some neurodevelopmental issues impacting OCD, frontal lobe development, maybe not perfectly named condition, right? But those same things, especially the history of epilepsy, whether it was accurate or not, we don't know, because you were on medication all these years, right, and so forth. But even the medication may impact some neurodevelopment because it slows down nerve activity, in a developmental phase of your life. So we don't know if your gut nervous system didn't fully optimize in its branching. Because, your neurons are still growing all the time. It's like even until you're 18, 19, your neurons are still growing. So some people just don't branch pathways all the way. Then they have, in a sense, they can have a gut neurodevelopmental delay. But that doesn't sound like yours, because you were having normal gut function all the way until that. So you were having regular bowel movements every day, no problems.
As far as I remember, yes, because I can clearly remember the first time I realized that I have bloating, and that was strange to me. Like I was like a balloon, and it was around 2004, 2005.
When you were 22. Okay. And that's when you were like in college.
Around college, or when I finished college. I think it was
at the end of.
Yeah, it was when I finished my military service. So 2003, I finished my military service. 2005, around 2005.
Okay.
I clearly remember that date.
In your early 20s. So
in my early 20s, yeah. In my early 20s, definitely. Because that was the first time I realized, hey, what's this? Why I'm so bloated? I can't remember if I had any gut issues before that.
Okay.
I can't remember.
So one of the things to think about is when we see like your gut issues are pretty much very characteristic of SIBO, small intestinal bacterial overgrowth, right? And even your test is borderline. It's not normal. At the very end, like when you go to 100 to 120 minutes, you actually have high amounts of, I think it was methane or hydrogen. I think it was hydrogen. High levels of hydrogen, which means you have borderline pathways. But also, there's bacteria in the gut besides. There's bacteria that produces gases besides methane and hydrogen that the test doesn't account for. But if you look at your symptoms, like as soon as you add in some vegetables, as soon as you add in some things, you get brain fog and your gut, you get bloated and distended and feel that. That's like the classical small intestinal bacterial overgrowth, where you have bacteria that should only be in the large intestine and the small intestine. So classically, like looking at your symptoms, you have bacteria in your small intestine that shouldn't be there because you're so sensitive to getting bloating and distension. Okay, and that happens mostly because the gut nervous system isn't working, because it can't control valves. So the valve between the large and small intestine, it just doesn't work well when the gut motility is impacted, and then bacteria just moves across. So it's not like you get a bacterial infection or you get a parasite or something. It's just the environment of the gut itself is not working to keep movement in valves, so bacteria moves across. They call it translocation of bacteria.
That was supposed to be a one-way pathway.
Yeah, so it's going the other way. And then when those bacteria species in the small intestine, the minute you eat, like you said, some kind of carbohydrate or some kind of vegetable, then you get distended and bloating. And then you went on carnivore, you felt better, which was like none of those things. FODMAP, you noticed some improvements, right? Yeah. So, I mean, that clearly shows that you have this small intestine bacterial population that's causing your bloating. So the cause of your bloating is not a mystery.
Got it.
Okay.
Can that valve be like got damaged at some stage for any reason?
Well, that's we have to get into this thing. So that would be like if you had intestinal surgery or trauma. None of those things were in your history, right? But you have this history of like potential neurodevelopment issues and epilepsy and bipolar issues and even major depressive disorder. All these things up until your 20s. So there could still be a brain-gut axis issue that's involved, and there probably is. But as far as like your bloating, like that's it. You pretty much get rid of your bloating if you didn't eat any starches or sugar, right?
Yeah. Like most of the time, like some of them, like water is fine.
Yeah.
But like even when I go on carnivore, I can't really go more than a week or two because I start having rashes.
Yeah, I'm not saying that's right.
But yeah, sometimes the vegetable works for me. But I know like for a fact that like garlic, that's just immediately. Yeah. So yeah, that's I do have. I avoid FODMAPs.
Right. But if you were just as far as your bloating concerns are, right, your gastrointestinal symptoms, the main one's just basic bloating and motility, right? Like
correct. The most thing is like bloating. I know how to control it, but the motility I don't.
Right.
That's difficult.
Those are the two main issues.
Yeah.
Right? So that's your gut nervous system, right? It's not like it's characteristic of like parasite or something like that. That's very clear. Movement is generated by the small muscles of your gut and the smooth muscles of your gut, the intestinal muscles. So basically, very clear from your history and the character pattern, your intestinal nervous system, your intestinal muscle contractions are not working. Okay, so it's an enteric nervous system issue.
Got it. And is that like the small intestine or large or both of them?
Both.
Both of them.
But the biggest issue is when the enteric nervous system isn't working, then it's constant motility issues and food doesn't move, and then food can just start fermenting and not being digested properly. And the thing is that the parasympathetic activity, like part of the nervous system that controls gut motility, is also involved with making digestive enzymes, causing your gallbladder to contract. So it's not efficient when that gut nervous system, the enteric being another name for gut, when the enteric nervous system isn't working, then you get the symptoms you have. And then bacteria, large intestine bacteria just moves into the small intestine and they cause that constant bloating distension. And the key to knowing that is also go on a carnivore diet, see if your bloating goes away. Yes, it does. Go on a FODMAP diet, see if it goes away. Yes, it does. So that's very characteristic of only the bacterial species from the large intestine and the small intestine. So we have that. You have that pattern. And then when you've taken antibiotics, you feel better.
Yeah.
Every time. Yeah.
And also water diet works really well for Ali.
Sure.
So if he goes for 3 days water diet, he feels amazing.
Right.
Intermediate fasting works really well.
Right. all those things that
If I don't eat, I feel fine.
that are found with not having your small intestinal bacteria exposed to source sugars that cause bloating and distension and so forth, right? Okay. So the problem with SIBO is like with small intestinal bacterial overgrowth, right? Is or these bacteria, let's just call it small intestinal overgrowth sounds like terrible because you think it's like overgrowing. It's actually a better name for it.
The wrong place.
Small, like bacterial translocation, abnormal bacterial translocation, right? Because of impaired motility. Think of it that way. What's going on? So the brain-gut axis. So one possibility is like the brain-gut axis disorder became a factor, or the gut nerve system just started to degenerate on its own. You know, and it just really caught up with you at age 22. That's unlikely because you're too young to have that happen. So another possibility is a brain injury. Did you have any traumatic brain injuries up before in your teens?
No, like the only thing I remember was people were saying, I don't know, I can't trust them. Like the seizure I had when I was 8 or 9 years old was because something hit me, but in my head. But
when you were how old?
Because the seizure happened when I was having breakfast.
Yeah.
So I was inside, but I was told, again, that's very unreliable, that like during football, like something hit my head, and that was the consequence of that. But
But do you remember losing consciousness ever?
When I had my first seizure.
Just your seizure?
Just my seizure, yeah.
Okay. Now,
nothing before that.
Some seizures are severe enough to cause brain injury. Do you remember the type of seizure you had? Was it they call it grand mal, where you were unable, did you lose consciousness during your...
I think the whole body. So
the whole body was...
The whole body, yeah.
Yeah, so you had a massive seizure. They used to call it a grand mal seizure.
Yeah, I think the whole body, and again, because that was many years ago, and I always say that was a pivot point for me. My life changed before and after that. 8 or 9.
Okay, so now we're getting into the brain, which is important. 8 to 9 years old, that's your first episode.
Yeah,
right?
yeah, and always tell my mother, hey, why was I put on medication if it was only once? And she told me that it wasn't once, it was multiple times.
Okay.
Yeah.
How many times?
Multiple times. I can't remember yet.
Yeah.
But as soon as I was put on medication, it was controlled, basically.
Right. It seems when I read your case history like you're upset you were put on medication.
I am, because the practitioner... I can't really find any... I'm not on medication since 2008.
Yeah.
12, 20...
Yeah.
How many years now? 13 years now?
13, 15.
Yeah, 13, 14 years now, and I have no issues. Like, I've had issues before, but like after I got out of them, I stopped taking them, I don't have any issues. I remember like my whole body was... Sometimes I had uncontrollable shaking in my body.
Right.
For no reason, or it was just startling.
So you should know that if you continue to have those seizures over and over again, that you could have had brain injury. So it's not all bad.
Yeah. All I'm saying is maybe it wasn't epilepsy, maybe it was...
Well, epilepsy, if you just have seizures over and over again, it's just classified as epilepsy.
Okay.
I think we lived in a country that for every small thing, people added lots of medication, and it's kind of common, so it's...
yeah, I understand.
People get so sensitive that did I needed to take the medication or not, so it's...
I know, but yeah, I understand.
Yeah.
But I don't think like you need
in your case
to worry too much. Like
okay.
It's not I wouldn't say it was the wrong thing to do, especially at the time not knowing what the options were. But you know, it does mean that there's neurons. So when they look at the reasons why people have epilepsy and the causes for it, they actually are finding that some of the neurotransmitter receptors are not working as efficiently as well. And there's sometimes genes that turn on the wrong way, but it's a defective neurotransmission pathway. So that can then impact, you know, the nervous system throughout your whole body, your gut and your brain. And that isn't like due to a nutrient deficiency or a supplement you need to take. That's just the way your genes expressed in your development and how you are. So at some point, especially when the brain's developing, it's very vulnerable when these things are happening. So seizures start to develop. Just the brain doesn't know how to integrate. You get a seizure response. And then the medication does stop that. But every time you have those severe seizures like you're having, there is some brain injury. And a lot of times people have seizures, they get severe traumatic brain injuries from falls from having seizures. So they got a combination of both. So there's genetically some neurotransmission patterns you have. Okay, and this is what I'm saying. Like sometimes there isn't a diagnosis to make. The diagnoses are clear. It's like, this is what you have. How do you function with what you have to the highest level? Right? Okay. So you have this gut motility thing really start to show up when you're 22, 23. Prior to then, no gut issues. Right?
I don't think so. No.
But then we look at your brain relationship here. Before 8 and 9, when you had your first seizure, were there any other issues? You were having some problems with learning how to write?
No, that was after the seizure. Yeah.
So clear it up for me, because when I was reading your case review, I'm not really understanding the timeline. So let's just think about the timeline from like your developmental function, your brain development, like handwriting, speaking, walking, up until age 8, before your first seizure. Were there any issues? Were there any delays?
I don't think so.
No problem with balance, no problem falling, no problem walking, no problem going to school, academics, reading?
No issues, no. None of them. The only thing is my mom was saying that I sleep too much. I used to sleep too much, yeah. Or I was a little bit slow, and she was worried that I have some problem.
So she did notice?
Yeah. But I didn't have any, as far as I remember, I was just outgoing and like any other kid.
Right. That's more personality. But when your mom was noticing you were slow, what did that mean?
Sleeping too much, maybe.
And I think it was when you were a baby, right?
Yeah.
Yeah.
Yeah. She tells me that when I was a baby, even if she had to wash me, I was still sleeping. And she was worried that something is wrong with me. Because why don't I wake up and cry like all the other kids? Maybe.
Do you remember how many hours you were sleeping? Because bad brain function does cause lots of excessive sleeping.
No, but as in like, the only thing I can, not that remember, I can remember from my parents talking, like I was so, as a kid I was so quiet and I was so low maintenance. So it wasn't like that I'm waking up all the time and they need to take care of me. So I was sleeping a lot. I don't know.
Okay.
I don't know what's a lot, but yeah, as a kid, that was like before 8 years ago. That was the only thing.
Okay.
I can remember.
So nothing you can really recall.
The two things I can recall is like 2 spots on my legs, smaller spots, and a penny size. I remember when I was maybe 4 or 5, they were bleeding, and even now when I take a look at it, there is no hair in those areas. And again, as a kid, I had OCD symptoms.
Okay, so
I was very grumpy.
When did the OCD start?
Maybe I was 4 or 5.
Okay, well that's what I'm looking for. So 4 to 5, you were having symptoms of OCD.
Yeah.
Okay.
Yeah. Clear memories of OCD type of behavior.
Yeah, that's the first time. Yeah.
And what did you have written? Like you wrote, you had some rituals developing at the time.
No, it was just so the attention to detail was just too much.
Okay.
And then, like I remember, we had a painter painting our house, and it was just telling him, "Hey, that this line is not good enough." Or and I clearly remember that, like maybe I was 4 or 5 years old, and he was telling me, "You nag a lot. Just stop doing that. Let me do my work."
But it would cause you anxiety to see it not painted that well, right?
Yeah.
Yeah. Like and then the way you would deal with your anxiety is to fix or make comments.
Yeah. Yeah, making comments that, hey, this is not
right.
Yeah.
Aligned.
Yeah, this is not leveled.
Okay, so like 4 to 5 years old, OCD would be considered neurodevelopmental.
Mm-hmm.
Like neurons are not connecting and migrating and moving the way they need to move. Okay, especially with the frontal lobe. So the frontal lobe is involved with dampening those compulsivenesses that are involved there. Okay.
Now, I don't want to name it OCD because I really don't know what's the right definition of it, but that's what I basically explained to you.
Like, this is a very general term.
Yeah.
Do you have obsessive compulsive activity?
I was obsessed over
everything. Yeah. Okay.
And that helped me in my like education a lot.
Sure.
Yeah.
Yeah, you can be very successful.
Yeah.
Okay. So, all right. So what we're seeing is like some OCD behavior symptoms, 4 to 5, and then 8 to 9 is when you first have your seizure.
The first time I've experienced seizures, and I think they wrapped it up in a week, I think. And I think there was a lot of going to hospitals, going back and forth, and every practitioner wanted to do something, but they managed it. I think the seizures happened 2 or 3 times, just in a period of a week, maybe a month. A couple of times it wasn't excessive, it wasn't like happening every time. The only memory I have is I was having breakfast, and I can't remember anything, but someone was holding me and putting me in a car to drive to the hospital.
Yeah, you lose consciousness.
That's what I remember.
Yeah.
And I don't remember anything after. Like my 8 years old or 9 years old when I had that year, I don't remember anything from a school. I don't remember who was my teacher. I remember who was my teacher in other.
That's brain injury from the seizure.
I don't remember who was my teacher. I've managed to find some old photos of mine, and in every photo that I have after that year, on the side, you look at my face, you see that I'm in pain.
Okay, so just so you understand, that's brain injury.
Mm-hmm.
That's the seizure causing brain injury. If you weren't on the medication, you would have that all throughout your brain. Mm-hmm. Okay. So tell me what's happening with your neurological function, your mood, your OCD, your behavior, from age 9 till, like, let's say end of high school.
Age 9 to end of high school. So learning has started getting difficult. I know that it is too early to say that the learning is difficult, but like year 1 and 2 I was fine, but after that it was difficult. Some stuff helped me, like for example, the handwriting was just very difficult. It was very difficult for me to do tahriri, like calligraphy in Irani, in Persian. Very difficult for me. I couldn't figure it out. And I was putting a lot of, like, again, OCD-like symptoms. This time it wasn't like I was nagging. I was putting a lot of pressure, and I still have that.
Just from trying to write?
Just, yeah. So I had multiple pens because I was breaking them left and right.
Okay.
And the pressure was so much that you could see my handwriting in page 10.
Right.
And the first 2 or 3 pages were tore apart.
Right.
And but I was still managing. So my grades were really good for the first until year 5. Everything was good. But after that, in middle school, I started having problems.
Right.
I started having learning problems. Like math was always easy for me, science was always easy for me. I started having issues with math to the point that I had to get a tutor.
So what grade? How old were you?
It was year 6.
Year 6.
Yeah.
So. Okay.
Yeah. So it was year 6. I remember, and I was having difficulty with that, and I started having really focused areas. Like I liked, for example, English was the first year we were having any English courses. It was on year 6. That was easy for me. But math was easy, but I couldn't find myself to, like, I was daydreaming most of the time, and I was just being behind to the point that I had to someone else to explain it to me.
So you had a problem with focused attention?
Yeah.
Concentration?
Yeah. Yeah.
Okay.
And also was very subjective.
I mean, those things would fall within the definition of most people classify that as attention deficit, where you're just having a hard time focusing, concentrating, you're daydreaming all the time.
Yeah.
Okay.
Yeah. But I was still managing. So with the help of tutor, I was still getting good grades. So that was fine. But in high school, so that would be what was that year? And it's like 5, year 9. Year 9 of school. I started developing this. I was really subjective to
what to study
and what not. So, like, for example, you couldn't force me to learn Arabic, but I was a whiz with math. I didn't like literature, but I liked physics. So it was very, very extreme, as in, like, I was aimed to go to Sharif University, but just because of that, I was doing like maybe 90-100% for the courses I liked, but I was doing maybe 50%, even lower than that for the other courses. Yeah. So I started having really unbalanced, big mood swings. I mean, it was irrational. When I'm looking at it right now, the decisions I was making was very irrational. I think it was the first time it started for me having irrational decisions.
Okay. So that's all, like, when you look at it from a neurology point of view, you have a lot of right brain deficits where you can't do calligraphy, right? You do better with math, which is more left brain. So different parts of the brain are developing, right? And then when you're a kid, your brain actually develops one side a little bit more than the other, and the other one catches up, and then one more, and then it kind of goes like that. But irrational decisions and inability to focus, attention, concentrate, those are all frontal lobe. Even now, on your questionnaire form here, like your frontal lobe symptoms are there. And if you want to classify it, because people like to classify everything, so that would fall under attention deficit. So if you were to get another label, you would have attention deficit with OCD, right? So you would fall within those diagnostic criteria if you were being evaluated today with the healthcare system.
Got it.
Okay.
Got it.
So
in all of those years, the thing I remember now, I basically stopped any group activities.
So you became no social interaction.
No social interactions.
And why was that? Because you weren't acting properly or appropriately, or they would give you anxiety, or what was the reason?
I didn't fit in. So, for example, gym, if people wanted to play basketball or football, I had terrible hand-eye coordination.
Coordination is off.
So I was the last person to be picked. So I was spending that time doing something else.
Yeah.
Something solo. So if I can get a racket and a ball and do a squash for myself, I was happy.
Right.
No one was there to judge you.
Right.
Or video games.
Or video games. Yeah. So from age 8, 9, that was when I started doing a lot of video games. I was good at it, and I didn't have to interact with anyone else.
Okay. How's your coordination now?
I think it's better. Yeah, it's better. Even on the, as you call it, the right side brain. So I think I'm getting better.
Yeah.
Okay.
And now these days I'm finding it more difficult to. Learning is getting a bit more difficult on the other side. So it's not difficult as in I don't understand. I don't sit down and spend time to do something, and that's mainly because I have a lot of ups and downs these days. So it's not difficult. When I'm, for example, let's say a computer science topic. If I sit down and spend time on it, it's easy for me to understand what's happening, but I don't sit down and spend time on it. It's a little bit difficult.
That would require focused attention.
Yep. Yeah, exactly.
Yeah.
Exactly. And he wasn't good with drawing any type of
right.
like painting or anything.
But
life. These days he just do a few things, and it's okay. It's not amazing, but it's okay.
Okay. So listen, this is the world of developmental disorder. Okay, I don't know if the word is disorder. Okay, but this is developmental. Let's just call it inefficient development. More than likely, your inefficient development is probably related to like a seizure pathophysiology, meaning some of those neural synapses just aren't efficient. You know, and it has nothing to do with your intelligence. It just has to do with how neurons connect. You obviously you're accomplished. You know what you do, and a lot of the geniuses of our time, have developmental, what we classify as developmental disorders. Einstein didn't speak till he was like 8 or 9 years old, and he pretty much just had a left brain, and his right brain was a problem. That's why he never could connect with a lot of people, didn't talk to people, didn't interact with people. He had issues with that, so you can develop in certain areas, and it happens to many people. So now it's impacting your gut also. So these developmental delays can pop out because once you get older, there's a point where you start to degenerate. So now you have developmental delay in combination with degenerative mechanisms. Yeah. So with developmental delay, I think developmental delay is there's less connections. So there's less branches around. So as neurons branch into each other, you have function, right? So the key thing with development is there's lack of branching. Now you can enhance branching with activity, right? If you were forced to do calligraphy, through pain, suffering, and emotional distress, you would eventually learn it.
Mm-hmm.
It would just be very difficult for you,
Mm-hmm.
right? So the potential is always there, but it's just like, what's the cost of it to do it, and how do you function, and how do you enjoy your life with, which is, we all make those decisions. Yours is just much more extreme. Okay, so the other thing is you have autoimmunity. It's a neurological autoimmunity. So we don't know, so what all of a sudden made the brain gut axis dysfunction, right? Because we know you have some type of decreased development that's happening throughout your whole life, really, from OCD to some depression to attention deficit, right? And then you turn 30, now your brain gut axis isn't working. Now your enteric nervous system isn't kicking in. So that's all part of it. So it's possible that when your brain gut axis disorder didn't kick in as well, it's maybe when the autoimmunity turned on, or it's hard to say.
Yeah.
Okay. Because you have some neurological antibodies on your test. And I'm not sure if we'll ever know. I don't know if we'll ever really know the mechanism. We know you have a brain gut axis issue, and more than likely these neurological mechanisms you have are genetically induced because of an epileptic phenomenon. So we have to kind of work with what you're at, but you can still be highly functional and improve your function all the way through, right? So we're gonna figure that out, what you need to do. But also, there's a lot of wasted time. Going, is it just a thyroid condition? Is it just something else? Or and your thyroid needs to constantly be evaluated because you have thyroid antibodies. A lab test you sent me, the TSH was normal, so you're not hypothyroid yet, but statistically, one of these days you're going to be hypothyroid, and then and you might even be there and not know it. And thyroid hormones can impact your brain function, can impact your gut motility, can impact all those things as well.
Yep.
Okay. So just to look at the big picture and kind of piece things together. Now, when I say this to you, does that make sense to you?
Yeah, it does make sense.
Yeah.
So we only talked about that, the year 11 of my school. I think that was the year I had a stomach ulcer. So
age 11?
Yeah.
Wait, the 11th year of high school?
Yeah.
So we call it junior year.
Yeah.
Yeah, junior.
So that was the first time I had to do any sort of, if you can call it operation, I've been on antibiotics for any reason, even for a common cold, but this was serious.
Okay.
I had to do endoscopy, and what I think right now is probably was an H. pylori infection. What I think what it was. Even the last time I did endoscopy a couple of years ago, they can see an ulcer, area with an ulcer. So that was the first time I did that, and my mother was saying that, why are you sick all the time? Why are you having some issues with some place, even cold or having some sort of issue? So for this one, I had to go and do antibiotics for maybe a couple of weeks, and I had to a specific diet for that. Well, I started getting better.
Did get better?
Yeah, got better.
Okay, so that's before age, because your motility issue started age 22, so you're age 17 here.
Yes.
Okay. So then, anything else from 17 to 22? So 2 weeks of dealing with the acute ulcer, and you got to treat it with antibiotics.
Yeah. Nothing else. I remember I've had this stomach pain all the time, and we didn't know what it is. So doctor after doctor, we realized that I have an ulcer, and I had to push myself.
So when you were 17 years old.
Yeah, put a lot of pressure here to get rid of the pain. 90. So school started at 97. So when I was 18, 19, and when I was 20, I started working in parallel to my university time. And the other thing that happened was I was getting a lot of pain in my knees. All right.
What year was that?
As in what year?
Yeah. I'm sorry. How old were you?
20, I think.
Yeah, 2021.
Okay, well, that 2021, you have arthritic peptide, which is joint autoimmunity, and you have myelin antibodies and thyroid antibodies. So if you look at your autoimmune profile, it's joint, thyroid, and nervous system, right?
Yeah.
So maybe 2022 is when you did turn on your autoimmunity, because that's when your gut motility went down.
Yeah.
And that's when your joint pain started.
Yeah.
Okay.
A couple of years after that, maybe 2 years after that, when I was 25, I started losing big patches on my head and my hands and my legs. Started doing
That's when
injections.
you had your autoimmune alopecia.
Yeah.
That was in your 20s too.
That was in my 20s too.
Okay, so that's what's happening. It seems like your autoimmune alopecia, your joint pain that's systemic, right? Both your knees are feeling it first, systemic, both bilateral.
Yeah.
And then you got motility goes down.
Yeah.
So looks
And
like
symptom to decision is very difficult for me. I'll give you an example. So these knee pain issues, I never knew that's not normal, because I was walking a lot. I thought maybe that's why, but every time I was sleeping I had to hug my knees toward my belly to get rid of the pain. Or when I go, even a couple of years ago, when I go to cinema, I usually had to sit down until the cinema is clear, after the movie is done, after the movie is finished, because when I'm sitting, my knee pain is so much that if I start walking, I'm probably going to block other people. And when I first told her that, hey, this is why we're sitting in our chair until the area is clear, she was like, and you don't have any issues? She said, no, it's not normal.
He was thinking it's normal. Yeah. Everyone has this problem.
Yeah.
But
so I have this difficulty of, okay, this is the symptom. This is not right. I have this issue, and it takes, like, I'm getting better and better, but it takes me time to realize, hey, if I have like stomach issues, I don't need to wait 3 months or 6 months to tell people that I have stomach issues. It's like,
yeah, it's possible that the H. pylori infection you had is what triggered your autoimmune disease, because H. pylori antibodies sometimes, well, they've been shown to have molecular mimicry with the thyroid, so they can turn on thyroid autoimmunity. There hasn't been any studies confirming it with joint and neurological antibodies yet, but it's very possible. Okay.
And it was around the same year, like after high school, around 20, that Ali started eating out as well.
Yeah, I remember reading that. But let's talk about the autoimmune a little more. Yeah. Most people that get RAF start with their hands, but some people start in their hips, some people start in their knees, and yours is in your knees, is everywhere now. Do you have anything in your hands?
I do, like downward dog in yoga.
You feel it?
It's very painful. It takes me 20 minutes, 30 minutes to warm up. But I realize, again, I need to take this with a grain of salt, but if I don't do nightshades, potato, tomato, the pain is less or non-existent.
Yeah.
I had potato a couple of weeks ago, just white potato, and the day after, whole of my body was stiff.
Right.
But again, what I'm telling you with grain of salt, because I don't know. Like, it's difficult for me to understand this is causing this symptom or not. It takes time. It takes. It's not like garlic that I know in 2 hours, in 1 hour.
Yeah.
It takes time, and by the time I start seeing the symptoms, it's difficult for me to realize.
Yep.
And especially because he's having a few different problems, like thyroid is there, like the gut issue, autoimmunity, so it's hard to say which one triggered what.
Yep. Okay, well with rheumatoid arthritis, with the arthritic peptide, you get something called rheumatoid factor. You ever heard of that?
No, I haven't.
It's a blood test they do to screen for arthritis. And rheumatoid factor is really a blood test where IgG and IgM stick together. They call it agglutination. And nightshades and lectins are foods that agglutinate and stick together. So there's a key feature of RA. It's different than other autoimmune diseases where there's this overactive sticking together of these sugars, like sugar proteins called lectins, glycoproteins. So you do notice a big difference being off nightshades. What about like nuts and seeds?
No, I don't think so.
But you also wrote in your history that you do feel better on an autoimmune paleo diet.
I do feel better. I have my own set of new symptoms, like I lose sleep, and that's another one. Like I do feel better. When I was on AIP for around a year, I didn't have any new issues or pains or anything else.
So why'd you stop?
I was having sleep issues. Like for 4 months, I couldn't sleep more than 2 hours or 3 hours.
You can stay asleep?
I couldn't stay asleep. Like 1 a.m., 2 a.m., I was waking up and I was up. I couldn't go back to sleep. at all. And I was like, AIP is very simple. It doesn't have to, but it can be low carb. And I realized that if I introduce carbs, I can get my sleep back. That was one of my theories. The other one was, okay, the supplements. Maybe I'm sensitive to one of them.
Because so it was happening at the same time.
It was happening at the same time.
Following a few phases, lots of supplements in there.
So I had to get rid of all of them, saying, okay, I cannot live. Like I was to the point that I wanted to resign. Okay, I cannot do it. Like I need to take one of these paths. I want to feel better, so I need to find a way to feel better. I cannot do both work in that. But I started removing supplements. I started introducing other stuff in. No gluten, no dairy. The stuff that are no, I've never added them in the past couple of years. But I started feeling better. It took me 6 months to start being able to go back to sleep. I started being more serious on yoga. I forced myself to do group yoga classes, and that helped me to change my decision on resigning. But it definitely, if I answer to your question, it helped. AIP helped for sure.
What do you mean by resigning?
As in, I had no motivation to continue working.
He was this close to resign.
Oh, from work.
From work.
But then after starting a few activities, you were
I wrote
able
that
to.
And then the case review, the way you wrote it, seemed like yoga made a big difference for you.
But at the same time that I
talk, it's more like that. Factor. Okay.
Both of them, like group activities, helped me a lot. Helped my brain to get out of that depressive.
But do you still have knee pain now?
Not that much, no. No.
So are you still following autoimmune paleo?
I am.
So now you're not.
I'm autoimmune paleo, but a couple of stuff. It's not like I do have. Maybe I have pistachios.
Rice.
I have rice.
You don't have bloating and distension with rice?
No, not with rice.
Actually, rice is the one that helps him sleep. So before sleep, he just have a very small portion, not a lot, and it helps.
Okay. I have eggs, like boiled eggs. Some of them, I have like some of the brands are good for me. Some of them causes bloating for me. I don't know why, but it does. I get bloated after having eggs. So I need to be careful which brand. And I need to try it in small. So a couple of items, maybe 4 or 5 items that are out of AIP. I do have coffee, half a cup of coffee per day.
No problem.
No problem with anything, as in only I think it's impacting my adrenal. When I sit down or I stand up, I get dizzy.
Yeah.
But that keeps me going. Like if I have coffee, that helps me to do my work. But it's a really, really a small amount of coffee, just half a cup per day. Yeah. But I'm mainly on AIP. I didn't have any gluten.
When you weren't sleeping with autoimmune paleo, was it just because you weren't eating enough carbs? Was that the main reason?
I think that's the case.
That could definitely happen.
Yeah.
Because you have to have glycogen in your glucose storage to make it to sleep through the night.
Mm-hmm.
If you don't have enough glycogen.
The other theory I have is because as soon as we had that discussion a week ago, I started doing AIP again. And funnily enough, for the past 3-4 days, I couldn't get enough sleep. And the theory that I have, I don't know if it's correct or not, is I cannot properly digest meat and oil. And regardless of what type of meat I'm having, it's not getting converted to whatever my body needs. So if you give me an infant food or food that older people eat, foods that are very, very easy to digest, as long as they're FODMAP friendly, that suits me. It gives me energy, and I feel better. So I've listened to a lot of your podcasts about gallbladder, if it's not working, or contraction issues. I was never able to figure out the supplements around this, like with HCl. I was never able to find my dosage. I was up to 7-8 pills. I wasn't feeling
any burning.
Any.
You can take digestive enzymes?
I do take digestive enzymes. I don't feel any difference.
You made it sound like in your case review you can't handle any supplements.
No, I do. I can handle some of the supplements. I don't see
like
any.
The very, very basic B vitamins.
Yeah, I do. Right now, the only thing I have is B vitamin and vitamin D
and vitamin K.
Yep.
And not even vitamin K these days now.
Well,
so that's a little bit old. Yeah.
There's no digestive enzymes on this list.
Yeah, so that was after this list. So I added my digestive enzymes, but I don't see any difference. That's the thing.
What are you looking for?
Like any sort of change in my bowel movement. everything
that
is
will never
so
pass,
so sticky. I don't know. Is SIBO related to bowel movements being sticky and not emptying completely?
Which enzymes do you take? HCl.
The ones from Apex.
Uh,
Can't remember the name, but
Enzyme Mix Pro.
yeah, Enzyme Mix Pro.
Okay, so that's like
I have two.
That's all. That's all like HCl
Yeah.
lipase. That's really good
Yeah.
with everything.
And I used to previously have, because it doesn't have huge amount of HCl, but I was having maybe 4,000, 5,000 milligram of HCl, and it wasn't
Okay.
making any difference.
Well, let's think. Let's talk about difference.
Yeah.
Because it's not going to change your motility.
Okay.
There's no supplement you're going to take that's going to change.
No, I think like the difference, I couldn't feel my dosage. I couldn't
You can
find
feel
out.
burning.
Yeah.
Yeah, it's okay. You may not. Some people just they don't get that burning sensation.
Got
They
it.
too
Okay.
much.
Got it.
All right. So how high did you get capsule dose were you taking?
8 capsules, 8,500, so 4,000.
Because the key thing is also one of the few things that actually will keep your small intestine from not having this bacterial overgrowth is to keep it acidic.
Yep.
So you really want to acidify your gut
Mhm.
as much as possible.
Mhm.
So it's not a bad thing, because the problem is you get bloating and distension. You open up your valve more,
Mhm.
and you get more bacteria that comes in.
Yeah,
So every time you get bloated and distended, you're actually making yourself worse.
yeah,
Mhm.
And then it can take you days and days to recover from that.
yeah, fair.
And then you get one distension and bloating, and then you get another exposure, and now you get this severe bacterial response, overgrowth, inflammatory response to your small
Yeah.
intestine, and you feel awful.
Yeah,
So just that one distension and bloating is a problem.
yeah,
Okay?
yeah, I do agree.
So
And I do agree with the comment on acidity, because having rice and other stuff, I think it reduced the acidity, and she was following the same diet as I, and she did a GI map test recently, a couple of weeks ago, and she has a strands of H. pylori.
Yeah.
okay,
And if she has it, probably I have it again.
possible.
Um,
And it's 3 weeks back, so it's pretty recent.
And I was telling her that maybe we are putting a lot of pressure on the not having enough acidity in our
Yeah.
diets by just putting a lot of sugary stuff.
Yeah.
Okay.
So you never had H. pylori, have you?
Never.
This was the first time
Yeah.
here.
Even,
Like it's
even
very
when
small.
Ali had H. pylori, I didn't have it, so this is the first time.
Yeah. And your other your GI map is not normal,
It's not
basically.
good,
Yeah.
yeah.
I've sent a copy to Susan, and she mentioned maybe you can, because of HIPAA, maybe you can.
Yeah. I mean, you would definitely have to do some labs on you. That's one of them.
Yeah.
So you can't take digestive supplements.
Sorry, but
Have you ever
which was
taken butyrate?
butyrate? Do you have any
Like
supplement?
from
name?
Apex, it would be Enterovite.
Oh yeah, I did. Why did I stop doing that? It was very gradual for me. I can't remember why I stopped doing that. That was the only supplement I kept that I'm wishing to be able to add again,
That's
because
the most
of
important one.
because of again I listened to a lot of your talks with
Yeah.
butyrate.
Yeah.
I haven't added that back in, and I don't remember. It was at the time that I had the sleep issues, and I removed everything, but I never reintroduced them back again.
Okay. So it's very unlikely that the supplements are causing you sleep issues unless the supplements are impacting your blood sugar.
Mhm.
Okay.
Maybe.
And when I wake up, I don't feel hungry.
Yeah, that's because you're probably having a blood sugar drop.
Mm-hmm. As in, I don't feel hungry.
Yeah, I understand.
Okay.
Yeah, that's not a good thing. I want you to have some appetite, but as long as it's not, you can see the thing is it's not so much about appetite, it's about your function.
Yeah.
If you wake up and you're shaky, lightheaded, and irritable, it's different. Some people get really adapted to their physiology. They wake up fully energized, high level function, but they're not hungry.
Yeah.
Their body's learning how to use their ketones efficiently. That's different. Okay.
Yeah.
But with you, so like up until now, so here's what I really think
Yeah.
so far. I think you have had underlying epileptic patterns.
Mm-hmm.
That's probably impacted neurodevelopment for you. That neurodevelopment, the way neurodevelopment works is you have gray matter and white matter.
Mm-hmm.
Gray matter fully develops by age 8, 9. White matter fully develops by age 18, 19. And at that point, that's your nervous system. And then you can develop connections called plasticity with certain activities and movements. You can degenerate your brain just with various factors that happen with aging. But the core system is fully developed by age 20, 21.
Mhm.
Okay. So when you look at your history, it seems like you've had some neurological developmental inefficiency, through your brain that impacted very clearly your frontal lobe, focus, attention, concentration, OCD type activity, right?
Irrational behavior.
All the irrational behaviors, executive function, planning, decision making, all that, right? Frontal lobe. So there's definitely some frontal lobe issues. If you had coordination problems, you're not very coordinated. That's your motor system, which is multiple regions of your brain. So there's a lot of that happening, right? So that's there. And you probably didn't have the best ideal enteric gut nervous system development either.
Mm-hmm.
And then it sounds like when you turn 20, boom, your autoimmune disease turned on. And you started to feel in your knees, right? You had the joint pain. And age 17, you had the H. pylori infection. That could have maybe been the triggering pathogen. It's hard to say. It's just, that's theoretically it's possible. And then your alopecia started turning on. And you probably had some inflammation in your nervous system, impacting your gut nervous system, and that's when your motility issues started.
Yeah.
Okay.
And at the same time, I had a major depression.
Yeah, I'm sure the major depression is probably your brain being inflamed and all these things happening all at once, and your frontal lobe not working, and the whole chemistry of that.
Yeah.
Okay, so now when we look at what do we do? There's a lot of things we have to do. Okay.
Mm-hmm.
So first of all, you're not the candidate of I just haven't been diagnosed properly. Mm-hmm. And if I get diagnosed properly and get the treatment, everything will reverse. Mm-hmm. That's not going to happen. Mm-hmm. Okay. So the diagnosis, without naming it, is you probably have an efficient neurodevelopment in your gut and nervous system with some autoimmunity on top of it, right? So how do we get you to function ideally with what you have? Because your autoimmune disease can get worse, right? You could have further neuroinflammation, further neurodegeneration. You could go into full-on hypothyroidism. You could have another autoimmune disease turn on. And you're at high risk for that because your gut function is terrible. Mm-hmm. And if your gut immune system is off, that potential progression can happen. Okay, so I was asking, do you have short chain? Do you take butyrate? Mm-hmm. Because butyrate comes from fiber, but when you eat fiber, you can't make butyrate. When you don't eat fiber, you can't make butyrate.
Got it.
And short chain fatty acids, and that's critical for your immune function. Mm-hmm. So butyrate and propionate acetate are all produced by your gut bacteria from fiber, but they become signaling molecules, and they control the immune system. They control inflammation. They control the brain-gut axis. And that's why if you can't ingest it, you have to take it. So I think when you look at your history, the fact that you associated your lack of supplements you were taking maybe causing sleep issues, it's possible, but more than likely it was just you're probably on an autoimmune paleo without enough carbohydrates. Because when you added more carbs, you were able to sleep.
Yes.
So
and I lost a lot of weight.
Right.
Yeah.
So I was 70. I'm always around 72, 73. With autoimmune, I was down to 66.
I think it was really close to a keto diet because of amount of oil and we were really low in carb, both of us.
Yeah.
So 72 to 66 is like 10%.
10% carbs?
Yeah. No, I think I lost 10%.
Oh, 10% body fat.
Body weight.
Okay, so let's talk about how do we improve your function.
Yeah.
Okay. Now, we should do an H. pylori stool antigen test with you, just to see if you get that infection again.
Sorry, before that, is it also possible that these ups and downs has anything to do with thyroid hormone? As in, I'm lower on thyroid hormone. It could
we have to do a updated thyroid panel.
Yeah, okay.
You've got to do a thyroid panel regularly because you have that thyroid antibody showed up twice, totally out of range.
Yeah.
So you definitely have Hashimoto's.
Yeah.
Just don't know if you have enough destruction where your body can't make thyroid hormones.
Got it.
Because if that happens, all your symptoms will get worse. Your depression, your brain function, your gut motility, they will all get worse.
Yeah.
So the thyroid hormones can impact your motility pathways.
And it's a point-in-time test, so should I do one when I'm in my down phase, as in when I'm not feeling well,
What's
or
that?
it doesn't the thyroid panel? So it's because it's a point in time. Is it possible that the markets are all good when I'm like now, or almost like now, and it's not really good when I'm down?
Yeah, you can do it both times.
Yeah.
Absolutely.
Because Ali kind of has this bipolar type of
Right.
behavior, and
Yeah.
it's really a pattern. And recently, it's so either he's really high and he's overachieving, or he's down. But the thing is, we do test when Ali is high because that's the time he has the motivation
To
or
go and
energy
test.
to go out. So we're not sure if we are just testing at the right time when he's really, really low.
Yeah, we can have you. So then the key markers to look at is TSH.
Mhm.
Like if you ran TSH just by itself,
Mhm.
it's like $20.
Mhm.
You can have like a bunch of TSH tests ready to go, and
Throughout the
then,
month, yeah.
and then just check it.
Gotcha. Yeah.
Yeah.
fair
So we can do that. We can check your TSH. You want to do that? You want to test every
Yeah,
week?
definitely. Yeah, definitely. That was just a question, really. Is that something? Is it a possibility?
It's a
or not?
possibility.
Yeah.
More than likely, like bipolar is just your frontal lobe fatiguing,
Mhm.
and you're done.
Yeah.
And
Yeah.
then your frontal lobe has energy again.
Yeah.
Then you can focus and concentrate and do things again.
Yeah.
And then boom, it fatigues, or an inflammatory response comes in.
Mm.
Something impacts the endurance, and then it doesn't function.
Yeah. Speaking of that, sorry for jumping
No problem.
all over the place, but in one of your podcasts, you also talked about exercise and people burning out completely. That's me.
Yeah, that's you.
Like if I do high intensity yoga
read
or
that.
something like that,
No, much.
2 or 3 weeks, I'm done. As in, like I cannot do anything.
Yeah, so that's your like
Yeah.
endurance level.
Yeah, or even for
Brain
smaller
endurance.
activities, if you have guests over and I like cooking for people, everything is fine. I'm all good, but the day after, for a day or two,
You're good.
I'm fatigued.
Right.
Yeah.
And is that your down part of your bipolar? So-
No, not necessarily. I'm just tired.
Yeah,
Okay.
the
Yeah.
down is really down. It feels like Ali cannot do anything, doesn't have any motivation. He just wants to quit everything.
Yeah,
But
lights.
when he goes up, he's way above an average person, like a normal person. He's so super like creative, high achiever. He do a lot during that period, and then he goes down. So it's
Okay.
up and down is all over.
So let's
the
talk
place.
about the bipolar patterns. So tell me about your fluctuations of ups and downs, like throughout the month.
As in, like how many days I'm up and
Yeah.
like these days, for the past 3 months, it used to be around 50-50.
50-50.
So I used to keep a logbook of days that was good and bad.
I mean, 50-50 throughout the week?
Throughout the
Throughout the
year.
month.
Throughout the year in 2021 and 2020.
Okay, let's talk about month first.
It was around 50-50.
Still?
So 50-50.
Explain that to me now in a week time frame. Could you have a totally good week and then a bad week?
Yeah, I can have a totally
So
good
it
week.
could be in episodes of weeks.
Yeah.
Okay.
And these days, especially for the past 3 months, it's more around 70-80% of down.
70 what?
70-80% of the time I'm down.
You're down.
So
Yeah.
so I'm down for 3 weeks, and then I'm up for a week, and that week is the time that I need to play catch up. It's these days. I don't know why, and I'm starting to develop some funny symptoms. Like I've never had issue. Like I started having itching in my back for the past month and a half, and I think it was olive oil. I've never had issues with olive oil. Again, I'm saying I think because I need to reintroduce it back again to see if it's developing. But it's gone. But of having another issue of me having a month and a half of my back itching, and I was ignoring that. I was like, I don't even see that. But then I finally realized why you have so many scratches on your back. It's like it's itching. Maybe it's the bed. Maybe it's the.
Okay, well, 80% of the time down is really bad.
Right now it's like
At
that.
this-
How long has it been this way?
3 months.
The past 3 months?
Yeah,
Yeah.
the past 3 months.
That's the worst it's been?
It's the worst.
Yeah.
No, the worst it's been was that time when I
When you
was
were 20?
24. That was
So-
4 months. I locked myself in a room for 4 months.
Okay.
Yeah,
but-
that
so
was the worst time.
That was the
ever.
worst, but in the past 20 years since, this is the worst it's been.
This
I think-
no, I've had worse.
No, I think
during AIP.
before AIP.
Before AIP, yeah.
Starting AIP, the previous a year before that, like Ali could hardly do the work. Coming back to home, he just had to lay down, and that was in and out. And for the weekend, he had to sleep to recover. So I think it was one of the low points, really
Okay.
low points.
No, it's not. It's not the worst right now.
It's
Okay,
not
sure.
the
so
worst.
explain to me what happens when you're down. No motivation, no drive.
No motivation, no drive.
What else?
I will be sensitive to light. I will be sensitive to sound and noise.
Okay.
No drive for work, for life, activities that he likes, even just playing video games.
Yeah.
No
or
pleasure.
studying.
Nothing brings you pleasure.
Nothing.
Okay.
And that's actually everything brings me pain, because when I'm up, I buy books, I buy electronic stuff.
Yeah,
to,
but let's stick it down for a second.
yeah.
Do you have irritability? Do you have anger?
Um,
No.
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 I'm very neutral, as in like don't care.
Just don't care.
Yeah, just don't care. I don't. No, I'm not. I'm not angry. I'm not even agitated. It's actually the other way around.
Okay.
When I'm feeling good, that's the time that I'm agitated. Why this is like that? It should be like
That's when your
this.
OCD's ready
Yeah.
to go.
And she knows that when I'm doing that, it's a good week.
When I see
Okay.
OCD pattern and he say why this mug is here, I
Yeah.
get happy because I
Because
know
his
he's
brain
feeling
functions.
good.
Yeah.
Yeah.
Okay.
And she gives me project. Do this, do that. It's the time to.
It's time to do it.
Yeah, time
you
to
get
do
a
it.
lot of good things done.
But no, the other times I really just don't care.
Yeah, I think it's no
Okay.
motivation.
So we have to like look at some things to monitor with you, okay?
Yeah.
To see if you're getting better. Like your bloating and GI symptoms, it's gonna be pretty easy.
Yeah.
Stop feeding small bacterial growth, it's gone.
Mm-hmm.
Okay, and when you do feed it, you're going to more likely get into a down state because you're going to cause neuroinflammation, brain inflammation, pulmonary autoimmunity, all that stuff.
Yeah.
So we'll figure that out later.
Yep.
But we want to look at your good versus bad day.
And one
patterns.
data point for the good days is his energy or mental power is like his superhero. It's not normal at all. Like he can finish something that a normal person can do in 3 days in 1 hour.
Okay.
Very precise, very clean. So he do a lot of things, and I think that's why he's successful at work or other areas because he can catch up. But it's a pain because if he has that capability, he wants to continue that, but then he goes down.
Right.
So it's a strange,
so many
observing it is a
unfulfilled
strange.
potential. That's what I
okay.
look at it.
So when you have the good days, you have your OCD come out.
Yep. And those are my good days. Yeah.
Then that's in the anger, irritability, everything is in
Yeah.
there.
And I always tell Ozzy maybe I had a thyroid destruction and I have a lot of hormones in my bloodstream during my good days, and that's why it's happening. And I know when I have a good day, some stage I'm gonna go back down.
So usually lasts a week.
A week, maybe 2. I've had three weeks of good days.
In
I have
best
like
case.
yeah.
Yeah, in best case, 3 weeks of good, but it can be the other way. 3 weeks of bad and then 1 week of good.
Do you notice any things patterns you get to that start to push you into bad days?
I start getting tired.
Fatigue?
Yeah, I start getting fatigued and I have to sit down and I don't want to go out and I know that it's happening. I started.
And when we say fatigue, there's different types of fatigue. Fatigue could be like muscle fatigue, tiredness, where the brain is still okay, and then there's like brain-based fatigue where you just don't want to think about focus, everything's fatiguing, you're cognitive.
No, brain is still good. I feel low energy.
Low energy.
Yeah, low energy, yeah. I think brain is still good. Brain is the next one that goes.
So your physical endurance goes first.
Yeah, my physical. So I need to sit down, and then sitting down, laying down, it actually starts degenerating the brain function, and then I'm gone. When I lose that, I'm gone.
Okay. Do you have any dizziness during these periods?
Not really.
Okay.
Apart from sitting down and standing up. And that doesn't happen all the time.
Do you have any trips, falls, coordination issues when this is happening? Are you more prone to those things?
No, not necessarily during those days. I do injure myself more often than other people. I think when I reach out to fasten a screw or do something, I might hit my hand to an area and just I realize, hey, I have a cut here, I have a cut there. Or when I'm walking around the bed, I might like hit my leg to one side of the bed, and I don't know why. As in, like I have those things, but they're not during any specific time of bad or good.
Understand.
Yeah.
Okay.
One data point for you is I can predict when it is coming because his eye changes, the way it looks a little bit darker here, or it feels a little bit sad, and some changes on his lips. It just looks different, and I kind of can predict this is coming.
Mm.
Can you send me a picture next time?
I can. I actually have one.
Yeah, I have it. I have it ready here.
Yeah, I just.
Can we see it?
Yeah, I have it ready here.
His lips definitely keep changing. It feels like someone that is in pain. He doesn't notice at all, but
I don't notice
a
any
day
of
or
those.
2 days after this starts.
Favorites. I have 57 minutes.
Let's see if there's any
She
changes
tells me
in
this
your
is
picture. I
an
see.
example,
Yeah.
but I don't see any differences.
Yeah.
You just look tired.
Yeah.
Can I get that on camera, please?
the same thing when I do a lot of physical activity, there is a good chance that I'm gonna collapse and go to that direction. Like it starts with
You do a lot of physical activity?
Yeah, it starts with tiredness, by body being tired, and then
Body being okay. So when you
Sorry
have
if it's not that
when you get
helpful.
sensitivity to light and sound,
yeah,
And-
it's getting better these days. Sorry,
and
this
nothing,
is
yeah.
this is the other one. I think I don't know. It's 2020 or 2021. Check marks are good days. Crosses are bad days.
Well, that's more than 50-50. That's worse.
Yeah.
It's like 60-40.
Yeah,
Yeah.
and
These
those.
days is worse than that.
Yeah.
Like these days, for the past 3 months, it's like 80-20.
Okay,
Past 3 months, yeah.
let's get you out of this.
Yeah.
Listen, this is going to happen to you for sure when your frontal lobe fatigues.
Yeah.
You gotta look at this as a frontal lobe fatigue issue.
Mhm.
So
Is that gonna happen by learning or by physical activity? When
both?
both
Physical
of them?
activity is frontal, like muscle activity,
Yeah.
coordination, movement. That's all frontal. So,
That's very interesting. Like when I'm feeling bad, when I'm driving, if I start driving, I start
feels
feeling better.
better.
Better, yeah.
Yeah.
Like if I can push him outside home and ask him to go to a supermarket and drive a little bit, it improves.
Yeah.
Like there's a big chance that he can get out of it quicker.
But 99% of the time I say
You don't
no.
feel like you
I don't
want
wanna
to
go out. I can push her out.
Easily,
Well, she cannot
but
push me
I
out.
You're
can't
a
just-
saint. You married an angel.
Yeah, I know. That's for sure.
He's good.
Yeah, that's for sure. She only married me for that 20%.
It must be a good 20%.
It is.
He's good. Like he always catch ups. Like when he's at high, he catch up, and he's really good colleague, good husband, good friend.
Yeah.
And that's kind of my pain, because if he can be like that, it's good.
Okay.
Yeah.
We got to figure out what's fatiguing your brain.
Mhm.
All right. Is there any, if you were inconsistent with your diet more than you are now, you were bloated all the time, would you have more bad days?
Yeah.
For sure.
For sure.
Okay.
For some reason, like if I have, again, I give you an example of garlic because then that I know
Yeah.
how it looks like.
Yeah.
If I have garlic, so I'm gonna have bloating. I'm gonna have bad dreams.
Yeah.
After I wake up, the first thing I have is I have depressive symptoms.
Okay.
I'm depressed. Like
Yeah.
I don't know if it's because of the bad dreams I've had or
No. But if you get lots of bloating and distension and your gut functions off, your brain function goes down, and then you get these episodes pretty quickly.
yeah. The first thing I feel is brain fog.
Yep.
Then after that, if not immediately, in a couple of days, I'm gonna be down.
Okay.
Yeah.
So if we put you on starches and sugars and fruits, you'd be a mess.
Depends
on
which
the
one.
fruit.
Like even with FODMAP, I'm a little bit finicky.
But on
Some
the
of
ones,
them I
the
can-
ones
yeah.
you can.
Yeah.
Yeah. Like
Yeah.
we could predict it.
Yeah, but
We can make a diet for him to totally
Yeah.
fall apart.
Yeah.
Yeah.
You can?
Yeah. I think I can.
I think we can.
Yeah,
I think we can. Like with garlic and stuff. But when I'm down, I actually feel like I want to have like rice and chickpeas. That's
True.
what makes me happier.
True.
I cannot
Does it
have
make you
meat.
bloated or not?
A little bit, but it's not that bad.
Okay.
Rice, not rice, but chickpeas can get me a little bit bloated. But I end up recovering faster with rice and chickpeas. It's like she knows if I'm going for, I have like a maybe frozen chickpeas and I combine it with rice, and that's where it helps me to get out of that state, and I cannot have meat, for
Have
example.
you ever tried taking things like 5-HTP or St. John's wort or those nutraceuticals?
5-HTP I've tried.
While you're in your down phase to get out of your
I
down
have
phase?
no recollection of.
Never tried that.
Never tried.
Okay.
I think I did. I think it actually helped. Sometimes it helped.
Yeah.
It was helping. Yeah.
If you have a lot of symptoms on
Do you
your
know which one was it? The one that I had. You were keeping them for my down days.
Oh, okay.
Yeah.
Well, what was it?
The 5-HTP.
It was
Why-
yeah,
yeah.
because you have all these symptoms of very low serotonin. So when your serotonin levels go down,
Yeah.
nothing brings you joy.
Yeah.
Like nothing makes you happy. Like, you have different types of people in down periods. Your dopamine levels are definitely down.
Mm.
Your serotonin levels are definitely down, right? So
The other the other remedy you have for me is turmeric,
and
the other Apex, gluten flam, and the other Apex, the O2.
Yeah. So inflammation promotes it,
Yep.
And then things that can impact your serotonin levels can help you come out of it.
And the motivation is so low that he doesn't even want to try the supplements.
Yeah,
If I'm successful, then he recovers quicker. Yeah.
Come on. Okay. All right. When you are down, if you do physical movement, have you ever tried any kind of physical movement? I know you don't want to do it.
It does help.
Does it help you get out of it?
It does help,
Okay,
but not every type of physical movement. If I go for a 20-30 minutes walk outside, that's not going to be helpful. But if I go for a 3 hours, 4 hours of hiking, I'm going to be in pain for the first 45 minutes. After that, I'm fine. When I get back home, I'm all good.
So the best times for Ali that he was in a better shape was when every week we were doing long walks, like 1 hour, 2 hours. So if he continue doing that, there is less chance he go down. But if, for example, if we do like short walks around the home, there is a chance that he comes back home and he crashes.
Okay. You know how to treat yourself for most things already. You're just not doing it.
Yeah, just when I'm down, it's very difficult to find it. Yeah.
Okay.
But yeah, I know like type of food. I'm sure I haven't have all of them figured out, but I know what I can eat. And also, if I push myself to do some sort of physical activity every week, that helps me as well. But when it happens it's out of nowhere. Yeah, it hits me like a truck.
Listen, we have to figure out two strategies working together. One strategy is to optimize you so you don't have a down period.
Mm-hmm.
Yep.
The second strategy is how to get you out of a down period faster.
Mm-hmm.
You know, and the net effect of all those is you have more good days and bad days.
Mm-hmm.
Okay. So let's talk about when you're down. So if you go for long walks, that gets you, like you go for a 3-hour hike and you keep you out of it.
Yeah, I'm gonna swear for the first hour, but after that, I'm gonna be fine.
I
So
wouldn't say if he's on the lower bottom, he's able to go for that walk.
Yeah.
That's if he starts that walk a little bit before this happens, then he's successful. But he wouldn't be able to use that as a strategy to go out of the situation. So the energy level and his motivation wouldn't allow him to start that long walk. We have to keep maintaining that long walk so that he doesn't end up in this situation.
You made a good point. So it's both the mood and energy. So sometimes it's the mood, I have energy.
Yeah.
Sometimes it's both, I just don't have energy.
And the reason I'm saying that, there was times they really pushed Ali to do that when he was in down, and he collapsed. Like in the beginning of the walk, he just didn't know what to do, and we had to go back.
Did you? Are you eating when you're down?
It reduces, so I'm gonna.
I mean, is it possible you have the mood, but you don't have the energy because you don't have enough fuel?
I wouldn't say so.
No?
No, I don't think it's
It's not that?
No, it's not that.
Okay. So when you're down, long walks can help you, rice can help you, and
Yep.
chickpea.
Yeah.
Anything else?
Like simple carbs,
Simple
as long as it's FODMAP friendly. I know chickpeas is not.
What about like dark chocolate, cacao?
I think it does.
I think it does.
I think
Yeah.
it does.
Yeah.
So that raises dopamine.
I think it does.
Yep.
And then what about? Okay, you said so 5-HTP. You notice helps.
Yeah.
Because like rice and chickpea is going to help raise your serotonin levels.
Yeah.
And if 5-HTP helps you, that's important.
Yeah.
Things like dark chocolate, cacao can raise your dopamine levels.
Mhm.
Like you might need to figure out a way to like change your mood and then boom, go for a walk.
Mm-hmm.
And then when you walk, you're creating your own neurochemicals,
Mm-hmm.
getting your serotonin back up, getting dopamine back up, getting blood flow to your brain.
Mm-hmm.
You know, so like that's the piece to figure out.
Yeah. I have to. I know. Like I've been focusing a lot on diet, but I have to add exercise to my routines. I just need to find a way not to crash after it.
Yeah, well, that's the thing. So
Yeah.
the way the key issue would be, it can't be too intense for you, obviously. So.
A 15 minutes high intensity training is gonna.
But
make
when you
me
go on these
crash.
hikes, they're casual hikes, right?
They're some of them are. So they are difficult, but they're over 4 hours or 5 hours. So not the whole 5 hours is difficult.
It's just the first, what, 45
Yeah, so
minutes?
the first 45 minutes is the time that takes me for my body to warm up.
Yeah.
About over, let's say 5 hours, maybe 45 minutes is high intensity. The other 4 hours is just normal pace. So I can tolerate that over a 5 hours period of time, but I cannot tolerate high intensity
Yeah, I
over
understand.
over 15 minutes.
But you know, that first 30, 45 minutes, when people get into their exercise zone
Yeah,
and get their, for you, it's like so you can continue.
yeah,
That's really when your neurochemistry of your brain changes.
okay.
That's when your serotonin dopamine levels really start to go
Okay.
up.
So again, that's what's causing to continue. Okay.
I'm just saying we got to figure out how to probably
Yeah.
raise your dopamine and serotonin levels
Oh, yeah.
when you're down,
Yeah.
and then get you moving.
Yeah.
Because there's going to be nothing better than increasing your brain chemicals than movement.
Yeah.
Like nothing. So
Uh,
supplements can only get you so far. Like they might like get you ready to go,
Yeah.
and but you also got to make sure he's got energy. Like
Yep.
he's got fuel, he's got food.
Yep.
You know?
Mental activity also works as well. Now that you mentioned it, I think like if I do an IT training with hands-on, so if I start learning something, if I can get myself to sit down and learn something for 30 minutes, 45 minutes, I'm gonna start getting better.
It helps.
It's gonna help. The other thing, I give you an example. I've worked Monday to, let's say, Friday, and everything is really brain focused, and you need to be focused, and you need to have complex algorithms and everything. When Friday hits and I stop that learning phase and I go to Saturday and Sunday, I start going down. It's going to be difficult for me to pick up again on Monday. I always tell everyone I'm like an old tractor. It was or a diesel engine. It takes time for me to warm up. I'm going to work really, really good. But if you stop me for any reason, it's going to take ages for me to warm up again. It's just an analogy that I have for myself. But in reality, you cannot always function. You need rest time. And the rest time is like poison for me.
Right. So why not do things? Why not continue doing things?
If I don't get tired, that's completely fine.
Yeah.
Yeah, I can do that if I don't get tired, and I was like that.
Yeah, he was like that.
I was working like that. I think I've mentioned I was working 2 days, 3 days, 4 days in a row.
Okay.
Without
So when do you guys have like a strategy when you're down? Just a chickpea and rice, and hopefully cross your finger.
don't have a good strategy. I
Not a
don't
good
think.
strategy. It's like changing the foods to this one, trying to get Ali outside the house.
Sleep helps.
Sleep
Okay.
Yeah, sleep
definitely
helps.
helps.
If I can get a day just resting,
Yeah.
I might wake up the next day.
When you're down, are you nice or are you an asshole?
No, I'm nice.
No, he's nice.
I'm always
Yeah.
nice.
He's always nice. Yeah,
I might be an OCD like asshole like person, but I'm actually
When you're actually
you-
when I'm actually good.
Which is a good
It's
sign.
good-
It's
it's good.
Yeah,
She's wanting to wait for you to be.
Yeah.
yeah. She's excited for me to be in that phase. No, I'm nice. I think.
No, he's nice.
Okay.
Yeah.
So when you go down, we want to do some things. We want to have you try taking some things to really raise your dopamine and serotonin levels,
Mhm.
and then we have to make sure you have fuel. You got to make sure he's eating.
Yeah.
That's food. Okay.
Mhm.
So there's a product called Dopatone, and there's a product called Serotonin. I want you to I'll have you order it and have it ready if you have a down period,
Yeah.
and then you start taking those, like 2 to 4 capsules, 2 or 3 times a day, and then but you got to plan that with getting movement.
Mhm.
There's still some degree, no matter how much of anything you take, where you have to initiate just starting.
Yep.
That's the hardest part.
Mhm.
So you have to like dig into your dopamine pools and initiate.
Yeah.
Yeah. Okay.
Does that same thing happen with training and education? Is that
It's
again
raising your
why-
dopamine level.
Yeah.
If it's stimulating enough for you.
Yeah.
Physical activity is much easier.
Mhm.
Much easier
Mhm.
to get a brain chemical change or movement than it is cognitively.
Got it.
Because it has to be so stimulating enough for you
Mhm.
to get your cognition right. And how do you pick how stimulating enough is it for you
Mhm.
to the time frame you have before you're done?
Mhm.
Okay. So dopamine, serotonin. You gotta make sure your blood sugar's stable. Okay. And then movement. And you guys just use hiking
Yes. Yep.
The key thing with this is it can't be too intense, right?
Can't be too
Cannot
intense.
be too intense. It
Yep.
has to be very mellow. Because if you go too intense, you'll crash.
Yep.
With
And
hiking,
intensity-
it can be a bit
Once you
more
start.
intense. Once I start.
Yep.
But you have to get
So
to that.
if I choose a hike that for the first 45 minutes it's a climb, it's not going to be good for me.
Okay.
Uh,
Is there anything else you've taken that's helped you get out of it? Like things to support your mitochondria? Have you taken things like CoQ10 or any kind of like D-ribose or any kind of fuel?
CoQ10 I've experimented, but it wasn't during down days. As in, like it was having it in general.
How about ketones?
Ketones as in exogenous ketones?
Yeah, exogenous ketones.
Not during down times, no.
So we got to find some fuel.
Yeah. Not during
I'm not sure you can use D-ribose. It's going to make you all super bloated. It's all sugar.
Mhm.
It really gets into the mitochondria. Okay, so we'll probably have you take some ketones. Beta-hydroxybutyrate, which are
Mhm.
exogenous ketones.
Mhm.
Take some use of serotonin, dopamine. When you're noticing his eyelids and his lips, do they get discolored?
I think it's a little bit darker.
Darker? Because I mean, this. You may want to do some things to increase your circulation right before when you're having that period.
And on one side, I think
Okay.
it's different. It's not aligned.
What about coffee? Does that help you?
It
When you're
does,
down?
Yeah.
Okay, so we're going to have you take 3 things. The one thing to raise your catecholamines, epinephrine, norepinephrine.
Mm.
It'll also help you with circulation and blood flow. And it's also initiating the frontal lobe. Frontal lobe is basically all driven by dopamine and catecholamines, epinephrine, norepinephrine, to initiate and plan to get started.
Mhm,
And then the pleasure part of it is all serotonin.
mhm.
We don't even care about the pleasure part for you. We just want you to get moving. But since it does have some impact, we want you to still trigger that. Okay, dopamine, serotonin, catecholamines, give you some ketones, get you to move, and hopefully you're not in a down phase as long.
Mhm.
If we try that, let's say you're in a down phase right now. Tell us what would happen. So you'd be down phase, you'd be totally depressed.
I wouldn't be here, for example.
You wouldn't just come.
Yeah,
Yeah.
I wouldn't. It's like I'd find a way to cancel or reschedule. Like I know, like in this example, that would be too extreme. Of
You
an
said
example.
why you supplements, would you take them?
I have no objections of taking them. Saying, yeah,
And if she asked you to go on a hike, would you go?
going on a hike.
I have my opinion, but
Yeah, I think not.
Yeah.
I think
No?
No, you wouldn't.
What can you do? Anything?
Nothing. I think supplements I might be able to.
Like
Go out for a
Provide.
coffee, maybe. As in, like that helps sometimes.
Yeah, I the most successful one is I can ask him to drive to a supermarket, and he drives, and then he just go
Okay.
outside of the house. That would be the extent, and
Okay.
then allow him to sleep. That would help too.
Okay. Well, you know it best. But the point would be to try to get ketones to your brain, give you fuel to your brain, give you some things to get your blood flow to your brain. At the same time, give you some natural compounds
Mhm.
that can change your dopamine, serotonin, catecholamine levels,
Mhm.
and then hope for you to kick in.
Mhm.
And then you gotta dig deep to kick in if you can,
Mhm.
you know, and then you can get out of it that way.
Mhm.
Okay. All right. So that'd be a strategy to write down. Now, for you to get into it, like, how many times a week do you get bloating?
Bloated.
Yeah. So now I'm trying to figure out like how to stop you from fatiguing.
Yeah. Bloating should be like extensive bloating or any type of any
Well, tell me
any
both.
size.
Tell me both.
So like, for example, this morning I was bloated. I'm just trying to understand. It really depends if I'm following the diet correctly or not. If I'm following the diet correctly, then I'm fine. But that's interesting. The same ingredients sometimes have bloating impact and effect on me. Sometimes they don't.
But on a given week, right now,
Yeah.
'cause you're right now you're shooting 20% good days.
Yeah.
How many times a week do you, unrelated to diet, not
Got
related,
it.
do you actually bloat?
No, fair point. In the past week, I've never had any bloating issues, and I'm fine. Like I've been good for the past couple of days. Before that, maybe 4 or 5 days per week.
4 to 5 days per
Yeah.
week. It's almost every day.
Yeah.
So almost every day.
A little bit of bloating. It's not extensive because I know what extensive is, but I have a little bit of bloating.
So what
Very
made-
little.
What made the difference from last week to this week?
I reduced my carbs significantly. As in, I removed my.
Well, that's what you have to do.
Yeah.
Like, it's right in front of you.
Yeah, understand that. At the same time, it's
The
difficult for
sleep,
me
I
to
think.
digest meat and oils.
Okay, so let's figure this out.
Yeah.
So you're not going to get out of this if you have
Mm.
you have such a sensitive brain gut access issue,
Mm.
and it makes such a direct impact to you crashing. Like 4 days a week means you're having bloating every day. You're having
Mm.
disruption every day. You're
Mhm.
getting your bacterial species to produce byproducts and
Mhm.
compounds all day.
Mhm.
And these bacterial byproducts that are in your small intestine that get activated, they're going to disrupt your serotonin pathways. They're going to impact your dopamine pathways.
Mhm.
A lot of research on these gut microbiome relationships with neurochemicals in the brain.
Mhm.
Then you're extremely sensitive to that. Okay.
I think we were not able to figure out the food.
But now you know what it is.
But the thing is, if we go really low in carb, Ali loses his sleep,
Right.
and he's going to have difficulty with meat and so on and so forth.
Okay.
So
Interesting, like chickpeas flour, it's not supposed to be FODMAP, at least that's what I tested, but I don't know why.
why you're okay?
That's why I have been.
Did you have
bloating.
chickpeas the past week?
Not that past week, no.
No.
Well, then maybe you can't have chickpeas.
Okay. Mm.
Yeah, I think we just need to figure this out to optimize for different type of problems here.
Yeah.
Yeah.
When you have autoimmune paleo diet on top of FODMAP, on top of blood sugar.
And recently, as he said, lectin as well.
Yeah.
Yeah. Well, that's
Yeah.
autoimmune paleo should be lectin free.
Yeah.
Yep.
Apart from rice.
Right. Okay.
And I think banana has
Did
some.
you have any rice this week?
Yes.
Yep.
And you were okay.
Yep.
Yeah,
He's okay.
What was your diet this week? That was so different than last week. Just the.
Just remove the really the sugary stuff. As in,
Yeah, I think
What was the sugary stuff?
just chickpeas. The only thing that's different was chickpeas. Yeah.
chickpeas and
And
maple syrup.
banana.
Maple syrup?
Yeah.
Yeah.
You can't do maple syrup.
Isn't that FODMAP friendly?
Sweet.
Okay.
Yeah.
Yeah, I think for the past year, these are the few small ones that Ali said that we introduced back at top of
Yeah.
the.
But I don't react to maple syrup. I don't get bloated.
Bloating may not be the only indication,
Mm.
Okay.
but
Honey, I do, but
if you look at what's an elimination provocation diet,
yeah. Mm.
if you're eating those foods and you're getting bloated,
Mm.
and then you don't eat those foods and you're not bloated,
Mm.
that's pretty clear.
Yeah. Diet I can work around.
Can you stick to your diet you had this week, ongoing?
Yeah, I can.
I think so. Yeah.
I can. I just need to reduce my meat intake a little bit, increase my carb intake.
What you have to do?
I just need to increase my rice a little bit and decrease my.
The meat, because
meat, yeah.
as an example, last night we had meat for dinner, and Ali wasn't able to
Yeah, I
sleep.
woke up at 2 a.m.
Have you ever
But
been
if-
into full ketosis?
I've been to full ketosis.
You measure ketone levels?
Yeah.
And could you sleep?
And not that good.
Not that good.
Yeah. And I was I had rashes all over my upper body.
Okay.
So,
So you have to. But so did you sleep at all this week or no?
in the past couple of days, because I mentioned I was again back on an AIP, so 4 or 5 days I slept one day fine enough. It was the day before last night,
Yeah.
because
So
I
it's
had
this week you
chickens
didn't
and banana. Banana helped me to sleep.
Banana helps you
Yes,
sleep.
banana helped me to sleep. But for example, last night was
Yeah. Like
full
if
meat,
we go,
yeah.
for example, remove the meat and go on, let's say, chicken, it doesn't have enough energy for Ali, so he can easily get hungry. If we do a lot on the rice, so if we increase the amount of rice, then I think he would get like FODMAP type of issues. So we just need to try to figure out what's the optimize so that he doesn't go have problems with blood sugar, the FODMAP, and the rest of it. I think if we get that one, it might help.
I need to, overall, I think we need to modify AIP in a way that it's a bit more balanced. I'm not saying, obviously, the no foods, but it needs a bit more.
You gotta figure out how to get enough carbs to sleep. That's on the FODMAP permitted list.
Yeah.
But rice is a problem.
Yep.
I think rice was one of the few items that people could introduce properly.
Have you tried like wild rice?
I think I'm sensitive to wild
You are
rice, at least on Cyrex.
Yeah.
I've never tried it, but I was just saying I'm sensitive, so I've never tried it. This Monash University, they do have an app.
Are you using the app?
Yeah, I'm using the app. We realized maybe I need to do less meat and more maybe poultry, chicken, and maybe seafood. Maybe those are easier to digest for me. Maybe it's
You might just have to eat later at night. What time do you eat at night?
7 p.m.
What time do you go to bed?
10, 11.
Yeah, that might be the problem.
Yeah.
You might have to have dinner like an hour before bed.
Yeah.
Just even if it's small. You got to get to sleep.
Yeah.
Because this in the FODMAP, the sugars and starches in FODMAP are going to disrupt your neurochemistry.
Okay.
Mm-hmm. That's very interesting because if I combine banana, rice flour, and chickpeas flour, and I make a cookie out of it, and if I have that, I can't sleep properly.
Yeah, but then
it's just,
you have a bad week.
That I understand. It's not like from a sleep point of view. It's just I feel like I observe and digest everything out of those because they're simple carbs. But when it comes to meat.
Yeah, what you're doing right now, your deductions may not be accurate.
Mm-hmm.
Okay.
So, okay, let's start with. So listen, don't add chickpea. Whatever you notice this week, you want to stick with, but you're still not sleeping.
I'm not sleeping now.
So let's stick with the diet you're on this week.
Yeah.
And the rice you got to be very careful with. I think if you can do FODMAP permitted vegetables more.
Yeah. If you mentioned that bloating is not the only factor, but I don't get bloated with rice.
Okay.
I have no objections of not having.
Stick with what you're on right now.
Yeah.
But let's just have you stick with what you're doing right now.
Yeah.
Don't add the chickpeas and the maple syrup.
Mm-hmm.
Okay. And whatever else you did this week that worked. But let's have you just try to eat later.
Yeah. Okay.
Because 7 o'clock, you might have to have another meal, a small portion meal.
Mm-hmm.
Before
bed, 10 o'clock or something.
Yeah, okay.
Preferably not like starchy.
Got it.
Yeah.
Okay.
That's when you have the most chance for bloating and distension and disruption. Okay, so experiment with some later type meals. So you got to follow the guidelines of an autoimmune paleo diet.
Yeah.
You have to follow the guidelines of a FODMAP diet. You may have to be a little more strict. But for now, just stick with what worked this week and then eat a little bit later.
Okay.
And then I'm going to have you take some ketones at nighttime.
Okay. I've never tried ketones at night, but yeah.
Okay. Let's do that meal.
And is intermediate fasting good for Ali? Because he realized if he doesn't have anything till noon, he feels better.
Yeah.
He just need to have a coffee in the morning so that he doesn't feel hungry.
Breakfast makes me fatigued.
Yeah. Let's stick with what you're doing.
Okay.
Yeah. Because you can't take too much of a load on your gut right now at all.
Yeah. So it's a good thing.
Yeah.
Yeah.
You feel that way?
Yeah. I feel like if I can eat like once per day, that's better for me.
1 meal a day?
Yeah. Other than having like 3 meals. That's difficult. I feel heavy all the time.
So your 1 meal, you're still only doing 1 meal a day right now?
I will.
So go through your average day.
Yeah.
Like wake up, tell me what you're eating, what you're doing.
Wake up, I have a glass of water, a couple of glasses of water.
What time do you wake up?
6, 7 a.m.
Okay.
And if I have something immediate to do, I have my water and I have a coffee.
Okay.
If not, if I can control it, I won't have coffee. I'm not going to have anything, just water. But I'm going to have a glass of water and lemon, a little bit of lemon. And I will usually have, so it's not one meal a day, it's 16 hours, 18 hours. I usually have my first meal around 1 p.m., 2 p.m.
Okay.
It's
Egg and salad and oil.
Oil?
And oil, yeah. Just recently I realized instead of olive oil, I'm doing, in the past couple of weeks, I'm doing avocado oil.
Avocado, okay.
Yeah.
Diversifying your oils.
Yeah.
Okay.
And
maybe some blueberries on the salad.
yeah, maybe some blueberries or blackberries on the salad, a couple of them.
Okay.
I have no, like if I do that, I have no discomfort or anything. And then I won't eat anything till 6-7 p.m. That's when I'm gonna have dinner.
Okay, so you have 2 meals a day.
2 meals a day, yeah.
Okay.
No, what I was saying is...
You can handle eggs? If I said you can't handle eggs?
I can, generally speaking. Like boiled eggs, I can handle it. But when I got here, so we got a different brand of egg, and I was feeling a little bit bloated this morning.
So it depends on the type of the
Depends
egg,
on the
so
type. I don't know what it has inside it, but some of them I can, some of them I don't. Like I found one organic pasture-raised egg that I can't tolerate.
Okay. So 6 to 7 p.m., what's your meal?
So it's usually a type of protein, usually either chicken or meat.
Okay.
And a little bit of rice.
Okay. And walnuts.
And walnut, yeah.
So what do you want to do at 10 o'clock? What do you think would work for your body the best?
I would prefer that. I used to do this as well, like the rice and walnut. I can push it to 10 p.m. Have it as the last meal.
Okay. So what you can do at 6 to 7?
Same thing. Just remove the 6 to 7. It's gonna be mainly meat,
just chicken?
kind of protein. Yeah, chicken or a steak or.
With some salad, maybe.
Yeah.
You can do veggies, salad.
I can do a little bit. Yeah.
You can do that because you're like.
Yeah. Again, the example that I've provided in that was when I don't eat anything, I feel like, let's say I'm on a water fast for 4 days. I feel good. If I eat anything, even as naive as a salad, I feel different.
Yeah.
That's what I'm saying. Not necessarily bloated. It doesn't make me bloated.
Right.
I feel different. I can feel that something happened.
Yeah.
It's like my body doesn't like the food itself.
Right.
As soon as I start eating something, and most things really, I eat anything, even meat or anything like that, I feel...
Your neurochemistry's off.
Yeah, I need congestions around my sinus area.
Always
having runny
after
nose.
eating meals, which is a strange, like...
Yeah, and these aren't immune reactive. These are like if you look at your food sensitivity panel, you're not reacting to all these foods.
No,
this is a disrupted brain gut access.
Yeah, and my panel really, because I had IgA or IgG, one of them was low. My immune system was low, so my Cyrus lab wasn't really precise at all.
Yeah, I don't think you have like severe food sensitivities.
No, I don't think so. Yeah.
A lot of people would interpret everything or having
Yeah,
these food sensitivities. They're not.
Yeah.
They're just.
Sorry, and forgot what was the discussion?
Well, we just wanted to figure out what you were going to eat at 10 o'clock.
Got it. Yeah, I think, and I've tried that. A little bit of rice, when I say I mean really little, with a couple of walnuts. That's something that can help me.
Okay, so listen, we're going to take your care into different phases.
Yeah.
Phase 1 is to get you to figure out how to sleep
Mm-hmm.
and not have any bloating.
Yep.
Phase 2, so you can tolerate supplements?
No, I can. I just need to be very careful in titrating them.
Okay.
I need to be careful.
We need to put you on, like, you're going to be malnourished. Like, you need some nutraceuticals.
Mm-hmm.
You need, especially butyrate. You need some short chain fatty acids.
Yeah.
You need to digest your foods.
I have like 3 bottles of butyrate that's sealed, and I'm waiting for a moment.
There's a whole protocol we use for SIBO, where we have there's certain botanicals and compounds that promote SIBO that I help formulate for Apex, that will get you like nutrient dense nutraceuticals, get you some short chain fatty acids, you can make it, some enzymes, just to get your physiology working.
Mm-hmm.
You know, so phase 2 would be like a SIBO nutraceutical protocol.
Mm-hmm.
Okay. Phase 3 is to improve your brain.
Yep.
And then anywhere along here, we need a protocol for crashes recovery.
Yep.
Am I potentially going to have any pathogens or anything like that? Is there
Any
gonna
what?
be any pathogens? Any, like, could I potentially have H. pylori still?
Yeah, we should. I made a series of labs to do with you.
Mhm.
I have H. pylori stool antigen test there,
Yeah.
and an updated thyroid panel.
Got it.
Just a regular routine blood panel so
Yeah,
far.
yeah.
Is there any tests you think we should do?
No, apart from thyroid and maybe something similar to GI map. I don't.
But why? You're gonna have dysbiosis. I'll tell you right now.
Sorry. What
You're
was
gonna
it?
have dysbiosis.
So got it. So I thought GI map is something for H. pylori, so that's different. Isn't it?
Yeah, yeah. We're gonna do
Yeah,
a stool
okay.
antigen test.
Yeah.
We can do that through antibodies or through breath tests. For breath tests, you're going to take the sugars, and
Yeah.
it's going to make you just really bloated, distended. So we're just going to have you do a stool antigen test, which means, unfortunately, when you go to the lab,
Yeah.
you're going to have to give a stool sample. So you have to make sure you're ready to give a stool sample.
Okay. I thought that the breasts and
Some of the labs, by the way, will give you a collection kit.
yeah,
You can just take it and come back.
got it.
But if you're ready to go, then you can just do it at the lab.
Yeah.
And then be done.
No, apart from
And
that,
food
nothing.
sensitivity wouldn't help Ali, right?
I mean, getting a new one.
Yeah.
I don't
Because-
think my
don't
what
think
was the
it's-
factor, like
it's-
IgA? I think
okay.
IgA
You
was
already
it?
had an array 10, so there's lots of distractions here. So like one of the distractions would be looking at the self-infant sensitivity, or looking at this like a leaky gut pattern, or
Yep.
this is none of those things.
Okay.
This is a completely dysfunctional gut nervous system,
Mhm.
Yep.
and for sure some impaired neuroconnectivity in your frontal lobe that you're going to have to optimize,
Mhm.
and then develop as much connectivity and plasticity as we can.
Mhm.
We can't develop your brain during your off time.
Mhm.
You know what I mean?
Yep.
The areas of your brain you need to connect are not the computer science
Mhm.
algorithm
Mhm,
parts.
mhm.
It'll be, we'll do a physical exam with you, we'll see.
Yeah.
Maybe you're bumping into things and doing it because your parietal lobe's off, maybe your cerebellum's off,
Yeah.
maybe motor coordination issues, maybe sensory perception issues, I don't
Mhm.
know.
Got it.
But you got to get your brain like kicked in, because you build more brain mitochondria.
Mhm.
Because you can have other parts of your brain fatigue and then you're down. Right.
Got it. Okay.
So,
The,
okay.
The last thing is there is a bump on Ali's back here, like at the back of thyroid that.
Not thyroid. It's
sorry, it's
shoulder. I
it's
mean. Okay.
shoulder.
Shoulder?
Yeah, and it keeps growing like
I'll take
for
a
the
look at it.
past few.
Yeah.
Yeah.
It's probably just a cyst.
Yeah.
Everyone was saying it's just a fat deposit.
Okay.
Nothing
Or
to worry
lipoma.
about.
It's either cyst or lipoma.
Nothing to worry about.
Yeah.
Okay.
Have you gone to a dermatologist?
No.
Oh. Probably just cut it out right there.
Yeah.
Okay.
It doesn't bother me, as in, yeah, if I carry something in my hand or in a specific
well,
postures, it's going to be extremely painful.
Yeah, which could, it's just with cyst or lipoma could do
Yeah.
that. Okay, let's give you a little break and then we'll do a physical
Okay.
exam.
Cool. Awesome. Thank you
Thank
very
you.
much.